So you're interested in international mission, and you've signed up to serve on a mission of Village Presbyterian Church. Let's talk about DRMP.
I think you mean DRMP.
Oh, DRMP. Okay. DRMP. What does that even stand for? DRMP.
It stands for the Dominican Republic Medical Partnership.
Yeah.
It used to be called Project Dominicana Medical Mission Trips, a task force of Village Presbyterian Church.
Yeah, that doesn't really roll off the tongue, does it?
Well, Chris, Andrea, and myself are going to get you up to speed and tell you more about the DRMP before your trip.
Here's something you may not know. The DRMP got its start in 1995 when a youth group from Village Church went down to La Romana, Dominican Republic to help build the Good Samaritan Hospital. On that trip, Shawnee Mission East nurse Bev Timmons participated and saw a need for quality, accessible health care in the Bates. So she came back to Kansas City and recruited her healthcare friends to go down on a regular basis to provide health care. And that was the beginning of what's now become the DRMP. Recognizing the value of the good work occurring in the DR, Village Presbyterian Church soon adopted the work as a partner ministry, and 12 years later, in 2007, it officially became the DRMP, with operating guidelines, a strategic plan, and an advisory board. While it's not its own 501c3, it is still a mission of Village Church. However, you don't have to be associated with Village Church to be a part of the DRMP. So enough about the history, let's talk about our work. The mission of the DRMP is to provide healthcare and health education to people living in the Bates and barrios of La Romana, Dominican Republic. Our goal is to provide medical care to people when they're sick, while also providing information so that people can prevent illness in the future. Through recent strategic planning sessions, the organization has decided to put an emphasis on education. Here's what we try not to do, is engage in anything that could be considered toxic charity. We work really hard to evaluate our practices and to make sure that the work that we do lifts people up and empowers people and does not have a negative impact on the people that we serve. Here's something that makes us unique. We've connected with groups in the US and Canada to collaborate on what's going on in the Dominican Republic. And this allows us to maintain continuity of care, collaboration on best practices, as well as maintain some level of cooperation on the work going on in the DR. This, along with our Dominican partners, helps us do mission work responsibly.
Our oldest partner is the Good Samaritan Hospital. This is the organization that runs Casa Pastoral, where you'll be staying, and the place where the surgical teams will be doing the vast majority of their work. The surgical teams perform life-changing surgeries to people who would not otherwise receive the high-quality care. The surgeries range from orthopedic procedures to tubal ligations to pediatric surgery. The surgeons and surgical team members perform an amazing service for the people of the area. We're grateful for the long-standing and ongoing partnership with the Good Samaritan Hospital. So don't mess this up. Another partner is the Jonas Center. The Jonas Center is helping us fund an ongoing expansion of our hypertension program into more Bates. It also works in collaboration with the University of Missouri's School for Nursing. And finally, get this, it's also providing scholarships to young adults who live in the DR who want to go to nursing school to give back to the Bates where they were raised. This is tremendous. There's also Light a Candle, a Dominican nonprofit that's bringing health education to the Bates. The Light a Candle staff is comprised of doctors, nurses, and administrative professionals, some of whom have family who grew up in the very Bates that you'll be serving in. So they care deeply about empowering the Bates residents to improve their health. The work that Light a Candle does is tremendous. There's so much, in fact. Maybe way too much. I'll let Andrea do this one.
One of our programs is called Multiplying Light, and this is a health education and leadership program for young adults in the Bates. This program is staffed by our Light a Candle partners, and they teach classes that last for about 6 to 8 weeks on some health education topic. Students take pre-tests and post-tests, and their attendance is monitored. And students that qualify graduate and they receive a certificate of participation as well as a t-shirt of their own design. And they're then charged with multiplying the light into their community and teaching their other Bate residents about what they've learned. We take data from this program and we have seen some amazing results. Students in this program have petitioned Central Romana to put trash bins in their Bates, or they've created tippy-tap water dispensers to help their community residents wash their hands more readily. Multiplying Light program is doing some incredible work in the Bates. The Light a Candle staff also carries the bulk of the DRMP's Child Health Promotion Program, in which children in the Bates are measured according to the World Health Organization's growth standards.
So who?
The World Health Organization.
Yeah. Who?
Oh, yes, WHO, the World Health Organization. The Light a Candle staff travels to numerous bates looking for children ages 0 through 5, and they weigh them and measure them and chart their growth on these World Health Organization charts. When children are found to be undernourished, the Light a Candle staff can provide special assistance and even counseling for parents. And the good news about this program is that it's not just a one and done thing. The Light a Candle staff continue to travel back to those same bates and check on those same children all the way through 5 years old and make sure that they are continuing their healthy growth and development. We've seen some amazing results from the Child Health Promotion Program. Kids who were found at one time to be severely malnourished are now happy and thriving children. It's really an amazing program. The DRMP also continues to fund health promoters in various bates, as well as our hypertension management program. The DRMP developed this hypertension program a few years ago, and it's actually revolutionized the way groups that work in the bates help manage hypertension. And in fact, that collaboration that Chris mentioned earlier, we've actually shared a lot of our programming and our data with those groups, and they're starting to adopt it in their bates as well. The DRMP, however, only does the hypertension management system in our 6 designated bates. And speaking of the designated bate concept, I wanted to tell you a little bit about what this is. This is a distinct practice of the DRMP that's actually starting to catch on to other groups in the United States and Canada. There are hundreds of bates surrounding the city of La Romana in the Dominican Republic, which is where we stay when we go. There's no way that our teams could go to every single bate in a year, much less a week. So what we've done is we've designated 6 individual bates that each of our DRMP teams go back to every time they go. What this allows us to do is create a sort of continuity of care between the times that our team visits to allow for our physicians to create medical records, to establish relationships with patients, and even make referrals from one team to the next based on patients who need to be seen again. This is the kind of relationship building that the DRMP really values that other mission groups just oftentimes can't achieve. And just a few quick words about our medical teams. They're comprised of medical and non-medical volunteers, and they address the common health issues that are found in the bates. The medical care in these mobile medical clinics, which typically take place in a church in a bate, includes wound care, treatment for infection, ongoing hypertension, evaluation and management, as well as treatment for other types of health problems. And these medical clinics also include a health education station to help educate bate residents on how to continually improve their health. From healthcare to health education, these DRMP programs are changing lives in the Dominican Republic. And that really wouldn't be possible without the help of our partners, the Good Sam, Jonas, and Light a Candle.
As discussed earlier, these partners provide us with the opportunity to be responsible in our mission work by allowing us to monitor and evaluate our programs, seek input on new ideas and the needs of the people we serve, as well as to maintain sustainability of our work. So here's the ultimate goal: foster local leadership, empower the people we serve, build capacity, and diminish dependency on outside help. So thank you for watching this video. Now we just want to take a second to thank our most important partner,
You!
Yeah!
All right, guys, let's wrap it up. It's over.
Okay.